Our skeleton may appear structurally like steel, but it's actually an active organ. The bones provide structure, anchor muscles, and store calcium. Osteoporosis or porous bone is a disease of the skeletal system characterized by low bone mass. For women, this occurs around menopause.
In the lady, they would tend to lose height. With micro fractures that happen, the bone starts to collapse down, and thus you get hunching of the skeleton, as you can see from here. Okay, so classically, if you sit in the void deck of the HDB flat for an hour in the morning, you see all these little ladies who are bent forward. Okay, they have this what we call dowager's hump. Okay, and you have a protuberant stomach because everything is pushed forward, and their lung function is also compromised. You can lose as much as 7% of your lung function because the lungs are all collapsed or compressed forwards, and they will also have back pain. The fractures can happen either just below the head of the femur or further away along the base of the neck. When this happens, it can carry quite serious consequences. I'm going to show you an illustrative case of a patient. From these x-rays, you can see patients who have sustained a hip fracture would have a mortality rate of 20%. That means 1 in 5 of these patients will actually die within the first year of sustaining this injury. Another 20% would be wheelchair bound, and the rest would probably need the use of a walking aid or the assistance of a caregiver in order to mobilize.
What triggers bone loss is unclear, but here's how it remodels. Osteoclast cells keep digging holes in the bone while osteoblasts keep filling them back in. Osteoblasts are less efficient at making bone than osteoclasts are at removing it. Although the difference is slight, this is what accounts for thinning as we age. Doctors say bones can become so fragile that simple acts like climbing the stairs can fracture the hips of their patients.
Two years ago, she had come before with a fracture on the opposite hip, on the right side, right? And I've put in this what I call hemiarthroplasty, okay, to replace the neck. That's the head was broken. She was well. She was able to walk. However, she defaulted treatment and didn't go on to continue with her anti-osteoporotic treatment. And subsequently, 2 years later, she's back with another fracture to the left hip. Fortunately, this left hip now, the fracture pattern allows us to preserve the head of the femur. So what we did was to put in what we call a dynamic hip screw. All right. So we preserve the head and the neck of the femur by putting this large screw with the side plate to hold the fracture together while waiting for the union to occur. Okay. Now she definitely has to go on to anti-osteoporotic treatment, otherwise other sides will probably suffer the same fate.